We'll go ahead and get started. We want to thank everyone for joining us today. My name is Sean Bediako, and I'm professor of psychology at the University of Maryland, Baltimore County, where I serve in the psychology department and have been a sickle cell researcher and community advocate for several decades. And I'm very pleased to be here today to take part in this session on understanding and misunderstanding sickle cell stigma. And I'm joined today by Dr. Kendall Moody, who is assistant professor in the School of Social Work at Howard University. We're joined by Jagu Ba, who is a civil engineer at W.K. Dixon and a part-time first responder with the Mecklenburg EMS agency, and is also a person living with sickle cell SS. And by Nevia Charles, who is a student here at Howard University. Now, all of us, again, we have kind of talked a little bit before the program started, and we've all agreed that we are going to have an informal or organic type of conversation where we can talk about some of the things that are concern sickle cell stigma. And as a social and health psychologist who studied this for several decades, I have a particular perspective about sickle cell stigma that is very academic, so to speak. And I think the benefit of our conversation today is that we will get a comprehensive, and our goal is to have a comprehensive conversation about what sickle cell stigma entails, how it is lived, how it is experienced, but more importantly, not to just leave it at an emphasis on all of the negative things about stigma, but really talk about some solutions. What are some things that we need to do going forward to address the issues and concerns that are related to stigma for people who are living with sickle cell? And then how can we generalize that beyond folks who have sickle cell disease or people who may be experiencing other types of conditions? So I just want to jump into it. And again, at any time, any of our panelists can feel free to respond. But I just want to kind of start things out with a general question. It's like, when you think of the term or the phrase sickle cell stigma, like what comes to mind based on your experiences? So Dr. Moody, Jagu, or Nevia, you can all feel free to kind of jump in.
Nevia, did you want to weigh in first? I will
have just a little tidbit. The first thing that comes to mind when I hear sickle cell and stigma is barriers to care. What was that?
Yeah, similar to what I was thinking. You know, I've been a researcher in sickle cell disease for a few years, and when I first got into this field, you know, I was kind of naive to the fact of how children with chronic illness, how they are perceived by others. And when I started, I'm a medical social worker by training. So I worked in a clinic with children with sickle cell disease who shared the clinic with children of other blood disorders, cancer being one of them. And just working with the population, both sickle cell disease and cancer, of course, got to give the due respect because they do need a lot of care. But also, I also see where children with sickle cell disease did not receive the same type of treatment, regardless of the presentation of symptoms. So when I think about the word stigma, that's sort of what comes to mind, is the difference in the treatment of maybe the same presentation, different chronic illness, but same disease-related symptoms. However, they're not treated equally, which is oftentimes related to stigma. So that's what I think of.
Okay, thank you both. Jagu, I know that you had left out and then we got you back in. When you hear or think of the term sickle cell stigma, like what comes to mind for you?
I think that my first thought will be what Nivea said, as far as healthcare. Not just as a patient, but also as a healthcare provider. I've seen situations where there is an immediate stigma when people say that I have sickle cell. Immediately there's something like a blockage, or like how people kind of perceive you. like an automatic image of you. But I think that the second point will also be people will also kind of perceive you as like a handicap. For example, in the workplace, people may not want to really deal with you or hire you because they have that stigma that you will be always sick or whatnot. So
I think you make, and all of you have made some very interesting points. It's kind of one of the things I find interesting is that when we think about sickle cell, we go almost immediately to talking about pain, and we look at the physical aspects of it. But what I'm hearing from everyone is that there's a social aspect, there's an interpersonal aspect, and there may be some structural aspects with respect to how you navigate these healthcare institutions. And so I'm wondering, can y'all talk a little bit in more depth about if you feel comfortable sharing an experience of how stigma has been enacted in ways that constitute this barrier to care?
like I can go ahead if you want.
Yeah.
Sure.
As a patient, my personal experience as a patient, I have had before cases like where you will go to the hospital and you will tell them that you have pain and that you're feeling pain. But there is a thinking of, I know what you're feeling. I know exactly what you're feeling, or something like that, where you actually don't know anything about it. And so the care goes very, very bad because from the get-go, you lose the patient. Because the way your treatment, the way of treating, I think that the way of treating every single patient is different. I've had that, and I had to leave that particular hospital and go to another hospital just because the care was terrible. And I was not a drug seeker or anything like that, but people always sometimes get to think that drugs that can treat regular people in pain can also treat sickle cell, which is completely different pains. As a provider, I've had to call out my partners because I work for 911 and we'll be called out for, sometimes it says on the computer, sickle cell crisis or something like that. My partner, not knowing that I do have sickle cell, will be like, oh, okay, we'll just do some IV and do some possibly pain meds. We'll see. And I'm like, it's not just that. It's not just that. First of all, it's not just we'll do IV and pen meds. There is a lot to sickle cell. It's not just IVs and pen meds. It's not just, yes, it helps. But if the person is in a very, very terrible condition, if you're not treating that, but you're just treating what you learn in the books, that's never going to help. So I get to sometimes call out those.
Yeah, you miss some things there. If you just treat what you see or what you see on the monitor, you do miss a lot. I don't want to jump ahead. I was actually I didn't know if Nivea, if you had a comment or.
I would like to build on that. Thank you for making space for that. I would like to just build on what Jogu said, that a lot of the stigma that we face can be a barrier to our care, but just like how Sean mentioned, it comes from a structural place. I think it stems primarily from the relationship that people of color, Black people specifically, have with like the healthcare medical system. So it's already coming from a space of a deficit where we have to almost prove what we're going through, or almost try and convince our healthcare providers while we're in excruciating pain, please see me, even though I don't present the way you may expect me to think that I qualify or that it justifies the care that I absolutely need. It definitely plays a huge role in, like how Jogu said, you lose the patient at that point. It plays a huge role in getting on top of pain. And I think I know from experience that with sickle cell pain, that it's an extremely time sensitive manner. So going through the ringer with someone who's supposed to be providing care to you is wasting very valuable time that can extremely exacerbate the situation that we're in. If someone's calling 911, like in Jogu's case, for pain, a pain episode, that's already something that's gone way far past the level of care they should have received at a much earlier time. And then they have to, at that point, be an advocate for themselves to, you know, be able to receive what they need in such an excruciating time. So I definitely think that it's a layered experience that we have to, you know, get thrown into from birth. So I think this research and this conversation is super necessary.
Yeah,
I want to come back to something that you just said, Nevia, but Kendall, I'll let you go ahead and jump in.
Oh, they you know, hit it right on the head there. And I was actually thinking of, I didn't want to lose my thought as Nivea was talking, because she hit on so many cool, so important points. And it just reminds me of my work that I did in the hospital, in a children's hospital. I worked for 8 years. And oftentimes as a social worker, you are the voice sometimes of the patients who, when they're faced with the medical providers, and not to demonize all medical providers, but sometimes they do come across some who have their preconceived notions of sickle cell disease. They're very textbook. They don't see the person that's behind this disease, you know. So oftentimes, as you were talking, Nivea, it just reminded me of several instances where I can remember, and I'll be quick because I know, Sean, you had another thought there, but I was working with a young man. He was an adolescent male, and he is diagnosed with sickle cell disease, SS type. And he had a really, what they call bad disease, you know, so disease severity was high. And he really tried to try not to use the medication. He tried acupuncture. He came to see me for what we use biofeedback, deep breathing techniques. So he was really trying to manage his pain, but he was also coming into the emergency room often. So they don't see all the other times where he's going to acupuncture, he's going to use these other non-pharmaceutical treatment modalities. And when he came in, I met with him in the emergency room, and nurse comes in, she recognized him. We talked to him for a bit, and we step out, the provider and I, and step out, and she comes up and she says, "Oh man, we're just fueling the future drug seekers of America," or something like that. It's pertaining to him. And it took me back a bit. When we paused, the provider and I looked at her, and we ended up coming back down. We went upstairs and we came back down to the emergency room, and handed her an article which described the prevalence of drug addiction in sickle cell. It's very small percentage, nothing to even be concerned about. So it was these instances where we have to educate and also tackle stigma where we see, and racism when we see it. Because if not, she'll continue to have these thoughts and perpetuate the cycle of maybe he won't come back to the emergency room. So yeah, that's my comment there. And I see, Nivea, your hand is up.
Yeah, I just really would love to interject on that point. I think it's absolutely ridiculous how we can be stigmatized for something, one, that we have no control over, and two, that we've kind of been set up for. If we're coming into the hospital for pain, the only avenues or alternatives that we're offered more often than not are narcotics. And then when we go to use what we're being taught to use, we get shamed for it, or we get denied it, even though they have, in many cases, built a dependence in many of these patients that this is the only thing I know to treat the excruciating experience I'm going through. But the person who's supposed to be helping me through this is side-eyeing me when I'm, looking for compassion in this space. Care is synonymous with compassion in my eyes. So I just definitely think that that's a cycle that I always have to have a little dry laugh at. Like, okay, I'm the one in the wrong, but y'all taught me how to access care this way. Okay.
Right. Yeah. We educate patients early on from, once they're able to really conceptualize the disease, we educate them, okay, if you know what works for you, then talk to your provider about it. But you see the catch-22 there. So it's a good point.
I think what's been mentioned is important. There's this idea that there's a layered experience. So this is not as simplified as we may think. It's not as unidimensional, that the experience of stigma is a multidimensional experience. And I know that in some of the earlier research that, I participated in, 7, 8 years ago, we started to have this conversation with people that usually when we use the term stigma in sickle cell, we act as if it's one thing.
Mhm.
And I wanted to know if y'all could talk a little bit about what are the different or the varied ways that stigma may enact itself in the sickle cell context.
I can start off with that. Stigma, like I said previously, is definitely multi-layered in the experience of a sickle cell patient. Stigma from being a person of color, since it predominantly affects Black people. Stigma from being a drug seeker, as Jogu had mentioned. That's like kind of a derogatory term that a lot of providers end up adopting because they see us in emergency care so often seeking, medication to be able to help us quell our pain. There's also, a stigma on an interpersonal level out within and outside of the healthcare system that because you are differently able, you are weaker or you are not able to withstand or you're not able to endure the same things that other people can. I can do the same thing y'all could do, just a little bit different, So I definitely can attest to the fact that the stigma is not unilateral. It's not just one way.
Yeah, thank you. Jago, I'd like for you to weigh in if you feel comfortable doing so. One of the things that you mentioned that we just kind of overlooked is that you're first a civil engineer, you're a part-time EMS first responder. And I think there's so much stigmatization in sickle cell about high levels of unemployment, low levels of education, all those negative things and negative tropes that are out there. And I'm wondering if you could talk a little bit about how you overcame those perceptions and what kind of drove or motivated you to pursue the route that you're currently pursuing.
Okay, so I'm gonna start from the beginning. I'll try to be very quick. So from the very beginning, when you're a kid, when you're just a child, if you have friends and you do have sickle cell and none of them have sickle cell, you are automatically different. When you're playing soccer or something, people expect you to be different. People expect you to be tired. People expect you to be just weak, like maybe you say. I personally never wanted to be that person. So it draws me to actually do more than than sometimes the regular people would do. I would always try to do more. And I got myself so used to doing more that if I don't tell people that I have sickle cell, most likely they won't know. And not because of shame or anything, but because I just got tired of people expecting me to be different because I have sickle cell. So I guess in a way it's for me to kind of show them that, hey, look, you never knew, but I do have sickle cell, but I'm not different at all. If as a matter of fact, if I don't tell you, you don't know. And so it just drove me to the point where I was like, I never really wanted to see myself as a very different person to this day. And I always kept on pushing on goals because like you said, a lot of people think that if you do have sickle cell, you're prone to die at 18 or at, I don't know, 16 or whatever the age it is, or you're prone to be sick and not reach your goals or something like that. And I never really wanted to be the person that gives those person the truth or their rights or whatnot. So I always strive to like push myself higher than average people. Like if people are doing something, I just try to push myself to do higher because because I know that one day, one day I'll be telling them that I have sickle cell. If I do low, then everybody's gonna expect me to. Then everybody's gonna be like, "Oh, that's why you were doing low. That's why this. That's why that." But if I'm way up there, everybody's gonna be like, really? Do you? And I guess it's a positive thing or it's a negative thing. It can be negative because I've had friends that had sickle cell and people just look at them like they have, I don't know, something very, very bad. So yeah, I think I just grew up like that.
Mm-hmm. Yeah.
Thank you, Kendall.
Yeah, so I thank you again for you guys for sharing. So in my work and the story I just described, and we talk about different avenues of stigma And just in my research, I come across now there's a lot of different terms and terminology for stigma. Health-related stigma is one where it kind of relates to the story I just described as being stigmatized against it in the healthcare system. But I know there's other avenues for this, and this is so tough for people who are living with sickle cell disease to manage. So, for example, social exclusion is one, and that I can think of. So I can recall, and this isn't the case for all of my patients or even the majority of my patients. Most of them feel included with their peer groups, but I can recall one patient talking with me about they were battling with depression. And he was telling me how he felt excluded because his friends would often not contact him to go places because, oh, he may have a pain crisis, or maybe, no, we have to stop what we're doing and make sure. So it's that type of thinking that often perpetuates this cycle of stigma in society and within more of a micro level within an individual's peer group. So there's a lot of different avenues that we have to start to peel back this onion and start to eradicate stigma so that people can feel included regardless of if you have sickles, it should not stop you from engaging with your peer group. So that's just really hit me when he said that.
Jagu, I see that you have your hand raised.
Yeah, I just want to quickly say that just to confirm what you just said, I personally went through that where my family members, well, not, I guess my uncles or something like that, sometimes would not take me to trips or something like that, just weekend trips, because they would think that I would need my medicine or I would get sick in the way or something like that. Just to confirm what you say, it's very, very real and it's happening day in and day out.
Mm-hmm.
Yeah. Nevia, you have
I
something
can
to add?
confirm that as well. I think that coming from the space of a differently abled person, oftentimes you may come across people who will try to manage your condition for you or think that they may know better than you do. And oftentimes it may come from, a good place, a place of them trying to take care of you or make sure that you're okay. But that does, pose a barrier. And I think that it ends up being a more labor intensive experience on the side of the patient or the person with sickle cell, because not only do we have to worry about educating the people around us about the stigma that we're going through, about the stigma they may be perpetuating, but we also may be inclined to, what kind of came in my head when Jogu was talking about his experience of, really being an overachiever. And I, would like to congratulate you. You're amazing, yes. Jogu. I'm very proud of you. But that's an experience I've had as well. And I think I've gotten language for myself as I've gotten older that it can be a form of masking. Like we're doing our best to not show our disability, or doing our best to not show people what we're going through. And I didn't realize that my, life of overachieving was really, in a way for me, like kind of a trauma response. Like, okay, they don't believe in me. They don't think I can do this, or they tell me that I can't achieve this or go here or do that. Let me do everything I can to be my best self and prove everyone wrong. Let me prove my own self wrong. And I think that masking can even be, even though it may have positive results in terms of achievements and accomplishments, it can also be have a negative impact on your relationship with yourself and your body, because it may cause you to really mute yourself or kind of negate your own experience. Like I've definitely pushed through pain more often than I should have, or told myself that it's okay, I got it. It's okay, I can do this, I can handle it because I know I'm strong enough. Just because I may need a little time to rest and relax doesn't mean that I'm not as strong as someone else is. It just means that I have a different modality of getting there. So that's something that I've definitely had to learn and unlearn to be able to, be a little more gentle with myself.
So look, both you, Nevia, both you and Jagu, like y'all have, as they say on the street, y'all have spoke a word, right? And I have to unpack a lot of this because I think this really goes to show two things. Number one is exactly how multidimensional and multi-layered the experience of stigma is, and why, as researchers, we just can't approach the study of it as if it's like a unidimensional construct. Like it's just something we can pick up with a questionnaire survey or a scale. Like I think it's very important, which goes to the second point I wanted to make, of how important it is to have space to hear these types of stories and hear these types of experiences so that we can truly understand the complexities that are involved in adjusting to, experiencing, coping, and overcoming stigma. Kendall, did you have anything you wanted to add?
No, I've really just I'm sitting back and I'm in all of Joku interviews, like the resilience and the stories that they were sharing. I'm just thinking about the patients that I work with in the children's hospital, but to overcome that, the resilience, that's the picture that we have to paint for the public, because oftentimes you hear stories about unemployment rates among sickle cell disease or poor educational attainment, but that's not always the case. And I think we need to, shed light on some of these great stories that you all are sharing, so I just wanted to add that in there.
All right, thank you. I do want to invite our attendees, if you have any questions for our panelists, feel free to place them in the chat. I believe that function is operating and should be able to, I will be able to convey any questions that you have to our panelists. As we wait for that, if you do have any questions, I do want to try to shift gears a little bit. Mm-hmm. So when we talk about the experience of stigma, we often underemphasize or overlook the part that it's a two-way street, right? So you don't feel stigma unless there's someone stigmatizing, right? In most cases, right? In most cases. So I'm wondering, like, if we start to think about what are some of the things that need to be done to educate people, and I hate to use that term education, because it's almost like you need to educate people to treat other human beings like human beings. If that's where we are, we might all be in a little bit of trouble. But I guess what is it that we need to do to empower people to broaden their perspectives and understand the ways in which some of their actions and reactions, in some instances, to people with sickle cell influences the thoughts, the emotions, the behaviors of people who are living with sickle cell? What needs to happen on the flip side of the stigma coin, and not just for the person who's experiencing the stigma, but what do we do about those folks who are enacting that stigma?
That's a good question.
I'll start off. I think, like I had mentioned earlier, we all need to just do better at coming from a place of compassion. For example, if someone were, going through their own experience of pain, let's say they broke a leg and it was outwardly apparent, they wouldn't want someone to look them in the face and say, "You're not hurting, you're okay, you look fine," So I think just coming from a space of compassion and putting yourself in someone else's shoes, whether or not you have or are experiencing what they're currently in the midst of, it really doesn't matter. Just, treat someone how you would want to be treated, golden rule.
Chagu, do you have any points you want to weigh in on?
I completely agree with what she just said. Just treat people like you want to be treated. That's just it, I think. And I think that if there was something to be done, I think that it will have to start from the head of healthcare, and go down, because there's so many misconceptions and just bad news about sickle cell in healthcare, that if you were to change something, I think that it will be a good start there.
Yeah.
Okay. Before I go to Kendall, Nevia, you had another comment you wanted to make?
Yes, I did. I wanted to just add on that people on the other side of the coin should seek to understand, because, coming from a place of compassion is great, like treating people how you want to be treated. Yes, that's a good place to start from, but that could also pose the assumption that you know what's best. A lot of times other people don't. Every person is a case-by-case basis. And I do totally agree with what Jogu said, that it does need to come from, top down. We can all tell each other on an interpersonal level in our individual interactions, like, okay, this is a better way to approach me with compassion next time, but that's not necessarily going to change the game. I think that because it is a structural stigma, that there needs to be a structural approach. It needs to be, trainings and check-ins and evaluations. Are we doing good at what we said that we set out to do? I definitely think that that would be at least a start.
Okay.
Yeah, excellent points. So just to add in, I'm trained as a social worker, as I stated, and I think that part of it is starting with the language that we use, especially in the healthcare system. And I don't know how you all feel about this, but and I don't have sickle cell, but I'm working with patients with sickle cell disease, starting with person-centered language. So not a sickle cell patient, or dare I say the term sickler, which I hope whoever is listening to this, do not use the term sickler, please. Person's name with sickle cell, or patient with sickle cell disease. So more of a person-centered approach, labeling the person, but also saying they have sickle cell disease is the approach that we want to take. Also, I believe it's important that we start by recognizing our own biases that we have towards a certain population. So really looking within ourselves. So I'm an assistant professor at Howard, and within my class, I'm teaching social workers to be aware of their own biases, because we all have them. We all have biases. So it's important to not ignore our own biases, or say the term, well, I don't have any biases or anybody, because this is not true. We all have biases. Recognize what those biases are, and then do something about it. Tell yourself you don't know everything about this person. I do an exercise in my class where we flash pictures on the screen, and they're supposed to say to themselves, not out loud, is this person honest? Is this person deceitful? Is this person hurtful? And I forget all the different terms there, and they're just supposed to ask themselves this. And they're supposed to say to themselves, well, do I have a bias towards this person, or this group, or this culture? And if they do, they need to do some more education about that, because that's where we start to tackle and eradicate some of the stigma that's around certain populations, particularly in people with sickle cell disease, not just children. My research is with children, but people with sickle cell disease. I think that's 2 points that I wanted to make there.
Yeah, thank you all. Kendall, your point just made me revisit, and I may have talked to you about this. I'm not sure if I ever did or not, because I've known Dr. Moody for a while. Mm-hmm. But yeah, one of the reasons that I got started doing stigma research in sickle cell was because of an experience that I had. It was in New York. I'll never forget this, in 2006. And I was participating with the Adult Sickle Cell Quality of Life Measurement Information, the Ask Me study. So I was doing some focus groups with that before it moved out to the field testing phase. And I was in New York. I was scheduled to do a focus group with 9 men with sickle cell. And my collaborator and I got there, set up the room, and we had people waiting out in the hallway. And I was, waiting for them to come in, or waiting to go greet them to come in. And when they started coming in, there was a person, and then I'll never forget this. He was a Dominican guy, and he, didn't look phenotypically Black. And I stopped him. I held my hand out and said, "Excuse me, can I help you?" And he was like, "Yeah, I'm here for the focus group." And my immediate reaction was like, because I knew the folks were getting paid a nice sum of money for this focus group. So I was like, no, you're not. No, you're not. I'm like, well, just, please let me get the folks who are here situated, and then I can come back and talk to you in a second. And then sure enough, his name was on the list I had. And I'll never forget when I looked at him, and the look in his face, and the look when we made eye contact, I never, ever forgot that. And I thought about, I'm like, here I am, a sickle cell researcher, right? I have been doing this. I'm aware of biases, but yet in that moment, even I was not immune to that. And that's one of the things that really I'm like, I spent half of the session apologizing to him for that. And we had a very rich discussion. So it actually ended up helping to kind of fortify some of the things we were talking about in the focus group. But on an interpersonal level, that was one of the things that really made me become so much more aware of the fact that, hey, I got to check my own self, you know, because we always have to see people as people and not by what we think that they should look like or what characteristics or traits they should have. And I never, ever forgot that experience. And it was like one of the worst feelings that I had as a researcher, but also just as a person. But it also really helped me kind of grow significantly. But I think to your point, that whole idea about bias is something that none of us are immune to. And that's kind of where I want to shift a little bit as well. Because we talk about the social exclusion aspect of stigma. We've kind of talked about the disclosure concerns aspect where, you may not want to reveal that you have stigma to just anybody because they may not understand. But I'd also like to talk a little bit about what about the internalization of it when that happens? And, I know that Jagu and Nivea, like you all have been quite open in talking about the experiences that you've had with sickle cell and how you've overcome so many tremendous obstacles and challenges. But if you feel comfortable, I'm wondering if anyone can talk about those vulnerabilities that people may experience. And what are some things that we can convey to our audience about how folks may want to consider approaching that?
That is a very heavy question, something that I hadn't even started to consider until more recently as I've grown to understand the way that sickle cell impacts me so much more than physically. The internalization of stigma and other people's perceptions of you is a huge impact on how you see yourself, on how you treat yourself. Just the same way I mentioned earlier about like masking, that was my internalization of people counting me out or, thinking that I could not perform in the same ways others could. So I'm like, oh, okay, like that just means that I have to go above and beyond or be bigger and better than what they could have ever expected from me. And that's a huge, like I mentioned earlier as well, that's a huge impact on how I treat myself. It doesn't allow me space for self-compassion to be that way because I'm adopting someone else's stigmatized view of me and they're not coming from a space of compassion. How could I expect to use their modalities to be able to care for myself? It doesn't work. So I definitely can attest to the fact that, acknowledging how other people have seen me as a person with sickle cell or as a sickler, as they might have seen me, or a drug seeker or whatever it may be, has definitely caused me to mute myself, has caused me to not show up in my full authenticity, has caused me to lie about my pain. Like I have a super, what people call a super skewed pain score. One, because I know how high my pain level can get, but two, because I'm like, I could thug it out. Like they telling me I'm good, that I don't look like I'm in pain. Like that means I could swallow it. It's cool until it gets bad enough to where I can't do that anymore. It shouldn't have to get to that point. It shouldn't have to get to a space where I'm like, all right, now I'm in enough pain for them to believe me. Like, let me go get help. No, absolutely not. So I've definitely had to, kind of deprogram my mind from the stigmas that I've swallowed and adopted from other people or other areas in order to be able to better care for myself and understand, no, you need to listen to yourself the first time because what you're feeling is valid. No, you need to be able to seek out care as soon as you can because just because you're going through something difficult doesn't mean that you're weak or unable to do things as other people may have led you to believe. So it has a huge impact. And thank you for asking that question because that's not something that we address a lot in this community.
No, you're welcome. Jago, do you have any comments?
Sean, if I understand well, like you ask how that stigma makes me think or feel or act. Is that correct?
Right, correct.
I would say that it's very heavy and a lot of people don't really want to accept it until they actually sit down and think about it, like seriously think about it. If I can give you an example, if you have sickle cell SS, your average life expectancy, as they say it, is, I don't know, they give you a number. So you sometimes you take that number and make it your number, and it will make you not develop plans. For example, you want to do something that you think that, you know, everybody's doing, or get married, for example. You're like, well, if I get married now and then 5 years later I have troubles with sickle cell, and then I have kids and then I pass out and then my kids are here by themselves. That may be the case for people that are like in their late 20s. If you in your 18s, for example, you might think of things like, well, since people are saying that I'm different and I'm not supposed to do this, I'm not supposed to do that, you may not want to really follow your dreams, you know, because you're just scared of what's going to happen in the future. You don't know. You have that people are telling you that you're different, that you can't do this, that you this and that, to the point where you have a specific thinking about yourself. And it limits you to reach some goals or be yourself to the fullest, because you're not sure about your future. If I can put it like that. Sometimes it makes you angry. Sometimes it makes you, like maybe you say, sometimes you want to hide your pain or your sorrow.
Mhm.
And yeah, I think those are the things that can come on my mind right away.
Yeah, thank you so much for sharing that. Thank you both for sharing that. I know, again, that's a vulnerable type of question to ask, and I really appreciate you being in that space to be able to share that with us. Kendall, any comments?
Yeah, and I hear what Joku was saying, and I often bring up a story where I was at a conference and a gentleman was there and he was celebrating his 90th birthday, living with sickle cell disease. So, you hear these life expectancy stories, which can be kind of morbid, and patients do internalize that, and like Joku said, make it their own number, But I also want to share stories like that where people are living very long lives with sickle cell as well. So I just wanted to push that out there. But also I wanted to bring up another point, which working with this population and showing, being a psychologist and working with patients, they do internalize the stigma, and they do often feel, and this really gets me, feeling guilty about having sickle cell disease, a disease that they did not ask for. They feel guilty about having it. And like Nivea said, minimizing their pain so that they don't have to feel a burden to anyone else. These are what and I always say children, excuse me, but patients feel about having sickle cell disease. And you often have to think about, well, what's perpetuating this feeling, this internalization? And it comes from a lot of different avenues, societal standards, as we talked about, more of a micro level and a macro level, where the culture and belief, these are all fueling this stigma. And you come across patients who feel depressed, who have anxiety concerns, who often even get to a point, and I hate to take it to, feeling even more morbid, but suicidal ideations. You come across these things. So, in my work, this is what I work to eradicate and to spread awareness of stigma so that we can start to, like I said earlier, peel back this onion, treat the upstream issue, policies, procedures, especially in the healthcare system. Whew. We have to start by tackling those policies first. Well, not first, but that's up there as far as the ranking. And then hopefully that will treat some of the downstream issues that you see in society as far as how stigma can really impact patients with sickle cell.
Yeah, thank you again, Kendall. I just want to add that we have a couple of comments in the chat. No specific questions just yet, but I do want to invite our audience, if you have any questions, in the little bit of time that we have left, please feel free to offer your questions to our panelists. But we have some comments from Dr. Rana and also from Mrs. Gibson. Dr. Rana is basically confirming what you're saying, Dr. Moody, that he sees it with his patients every day. And Mrs. Gibson is mentioning that parents and caregivers also deal with the guilt of having a child or children with sickle cell disease. And that's where I wanted to sort of shift as well in the closing minutes of our session. We talk about stigma as if it's completely an individual experience. And I'm wondering, Kendall, from your perspective as a someone who's trained in social work, as a professor, as a clinician who's worked with families, can you talk a little bit about how stigma generalizes out to the other family members, including those who are not directly experiencing sickle cell disease, but how it may affect the family or the community or the neighborhood? And then I'm also wondering, Jagu and Nevia, if you could talk a little bit, again, if you feel comfortable, about some of the ways in which, people around you have been coping or adjusting or trying to acclimate to stigma.
Yeah, I'll open the floor to Nivea and Jagu if they want to go first.
I can say for one thing, our experience, and I say our, meaning myself and my caregivers, like my parents, within inpatient care or emergency room care, we both have to battle, against the stigmas. We both have to be like my advocate to ensure that I get the best care possible, because there are people who may actively be barriers to my care because they think that patients with sickle cell don't need pain medication or don't, their pain doesn't qualify for it. So while I'm, in excruciating pain, my mom is outside the door battling with the nurses to be like, I need you to give my daughter the care that she deserves. I need you to, understand what she's going through, or at least just listen to our instruction as the patient, as the person going through what it is that we're going through. So my mother and my family just in general are very well versed in understanding the different stigmas and how we have to go up against them every day to make sure that I get what I need,
I think that I would say the same thing. Growing up, had few classes where people would just think different things, and my mom would have to step in a lot and say different things or talk to different doctors, just to get me the care that I actually need. My family have adjusted now to the point where everybody knows what they're supposed to do if those type of stuff was, or that stigma happens sometimes. I think that everyone in my circle, at least family wise, have been pretty okay with all of it, honestly.
Yeah.
Oh, yeah, I was just going to say thank you for sharing that. I was going to ask Kendall, I can't see the questions that are in the Hoover app. I do see questions in Zoom. So I want to ask one of those questions from Zoom, and then Kendall, if there are other questions in Hoover, if you can do those. Yeah, thank you. I appreciate it. There's a question from Takesha Collins about why do many people think that this is just a Black person's disease? I found out by doing research that it can affect many ethnics or people from many different ethnic groups, and that's true. I mean, of course, I have an answer to that question, but I'll let but this is actually one of the things I'm actually working on a piece about that, about how sickle cell became racialized, and I'm looking at a lot of the historical literature from 1910 to 1950 to kind of show how the zeitgeist at the time sort of perpetuated this idea of sickle cell as a Black disease. But what's really at the core of it is this notion of us that we have, or for us, to think of biology, or as to think of race as biology. And that's one of the I guess a short, brief response to that question is that part of the reason people think about sickle cell as being a Black disease is that we tend to conflate race, which is a social and political and legal construct, with biology. And we don't do or engage in a lot of the necessary cognitive work that allows us to really think about how those things don't necessarily overlap as much as we think that they do. And that's one of the reasons that we began to look at this as purely or as it's almost exclusively a Black person's disease, even though there's evidence that clearly shows that it's not. But I didn't know if anyone else had anything to add. And if so, y'all can feel free to weigh in, and then I'll let Kendall move on with another question.
I'll chime in. I feel like, I mean, I haven't done as much extensive research as Sean has, but I can say from my own perception, a lot of it has to do with optics. Like primarily you see Black people are experiencing sickle cell disease. If you see anybody or know anything about it at all, then we're gonna be the face of it. So I think that has a lot to do with why it has been racialized, that it's just us that go through it, when quite frankly, it isn't.
Yeah, that's interesting. We don't have any footage from the sickle cell clinics in Turkey or in Greece or in Bahrain. Like because we don't see that. But here in the U.S., when we do see it, it's almost exclusively embodied with Black bodies, for sure. Yeah, Kendall.
Yes. Do you want me to proceed with the question in the other chat?
Yes, please.
Yeah. Okay. So this is a question from Dr. Ashley Maxime Mormon. So Dr. Maxime Mormon, she is a pediatric psychologist working inpatient and outpatient setting to provide care for patients with sickle cell disease. And the question is, I am curious to know if from your experience and from your perspectives, if you've had any meaningful experiences in which you've been able to process stigma you've experienced with psychologists and mental health professionals. If so, what did you find most helpful in these interactions? And I think with this question is, are we processing the stigma that the psychologists and mental health professionals may have, or just processing stigma amongst sickle cell disease with other mental health professionals? I wasn't sure about that part of the question there, but we can answer both, I guess, if you want to do that. So I can speak for myself, for example, working with, and I think there was, before I go ahead. Oh, so Dr. Maxime Mormon is clarifying, processing your own experiences with stigma in a therapy setting. Okay, I see. I have not. I haven't done that, processed that. And I'll open the floor to everyone else if they've been able to process that with a mental health professional.
So I where I am located, my doctor has it's like a team where you have different doctors and a psychologist and whatnot, just to make sure that the patient is okay. So most of the time when you do see your hematologist afterwards, you probably might see a psychologist or something like that. I have had that before. Not many times, but I have had that before. It helped me understand why people think the way they think. And also it helped shape how I can formulate things in the future. Like if I go to the ER, for example, or if I go to the hospital in general, how I can talk to people and tell them what I need to tell them without them thinking about I'm seeking drugs or something like that. I think, and also that provider sometimes was able to talk to other providers about how I feel or about how care is supposed to maybe happen. So in my personal case, it helped that way.
I'll chime in as well. I think I've only experienced psychiatric or therapeutic care from a sickle cell lens. It's always been attached to my sickle cell clinic, thankfully. Now that I'm transitioned to adult care, I believe that may change. So that's something that I may have to navigate a little differently, unfortunately. We can talk about the differences between pediatric and adult care a little later, another time. I would like to say that my therapists have been really great in helping me identify the internalization of the stigmas that I have had and help me to really unpack just the the ways that I've allowed it to negatively impact me, in the ways that I had mentioned previously, which is why I say it's something that I'm currently in the process of unlearning, and that I have to continuously retrain myself that just because this is what the outside world may view or have an expectation of doesn't mean that that has to be your truth and your reality that you adopt. So I think that in terms of unpacking or processing the stigma, it is something that I had always understood and known, but just not really been so aware of how deeply it has affected me. And I think through therapy, it really has allowed me to be more aware of that and work on that better. I can say also that I think that I know that therapy and psychological care needs to be woven into sickle cell care, like intrinsically, because I hadn't experienced it for many years, like throughout my sickle cell care, but I can definitely tell the difference between when I do and when I don't get it.
Yeah, thank you for sharing that. I think, one of the things that I find ironic is that people talk a lot about how seeking mental health care is stigmatizing, right? And then here we are talking about how in order to kind of circumvent our way and navigate that stigma, we need mental health care. So in some ways, there's almost this idea that it's perhaps a double jeopardy if you're a person living with sickle cell who's trying to seek, behavioral health or mental health care or psychological care. I guess anecdotally, though, I think I've found from my experience that it seems to be like this is something that people are always asking for. So this idea about mental health care being stigmatizing, I don't necessarily see it as much in the sickle cell community as I see it in the broader Black community, or as people perceive that it's out there in the Black community, this stigma around mental health care. So I think that's a very important point to kind of process that has been raised. Mm-hmm. I don't know if there are any other questions. I don't know, Kendall, if you see any other ones.
No, there's no other questions in chat. So
great. And I know that we're coming up on the time for us to close out. And again, I just want to thank our panelists, Dr. Kendall Moody, who's assistant professor of social work at Howard University, Jagu Ba, who is a civil engineer at WK Dixon and a part-time EMS responder with the Mecklenburg EMS agency, and Nevia Charles, who's also a student here at Howard University. I'm Sean Bediako, and it's been my pleasure to serve as the moderator for this session. And I want to especially acknowledge all the organizers of the International Conference on Stigma. I can't tell you how important this conference is, and it's really an honor and a privilege to be able to participate in it as a moderator. So I want to thank the organizers and everyone involved with this. I just want to leave us with one quick thing. One of the things that I'm kind of gathering from both Jagu's stories and narratives, from Nevia's story and narrative, and also from Kendall's stories and narrative, is that you can be in it, but not of it. Mm-hmm. But we always have to keep elevating above it. Right. So on that note, I want to thank everyone for your time. I hope that you enjoy the rest of the conference and have a wonderful evening. Please stay safe, stay healthy.
Thank you. Have a good one.
Thank you all for holding space. This has been a great conversation.
Yes,
I look forward to having more of them in the future.
Thank you. Thank you, Sean. Thank
Indeed.
you, everyone.
You're very welcome.